Hi, everyone. Thank you for taking time out of your day to join us for the final webinar in our four-part series leading up to Construction Suicide Prevention Week. My name is Isabel Whaler, and I'm the project manager for this initiative. What started as a regional initiative in Kansas City in 2019 has grown to a nationwide effort to bring awareness to the high rate of suicide in the construction industry with the goal of saving lives. In 2022, more than 400 organizations reaching nearly 250,000 workers participated in Construction Suicide Prevention Week, and we are well on our way to exceeding those numbers this year. If you have not already, please be sure to register your company's participation on our website to receive your 2023 OSHA Recognized Certificate at www.constructionsuicideprevention.com. With approximately 7.5 million people employed in construction in the US and far more worldwide, we still have more people who need access to the tools that could save a life and reverse the trend that has placed construction as an industry with one of the highest rates of death by suicide. The Construction Suicide Prevention Week initiative provides free resources to people in and around the construction industry to help them start conversations, hold stand-down events, and share information with colleagues who may be struggling. Our goal is to put more tools in the hands of the people who build our communities, and this webinar is one of the resources we're proud to be able to provide. We want today to be interactive, so please feel free to submit questions through the chat or Q&A. Now let's get to today's program. Our moderator today is Angela Crawford. Angela is in the business of people and content. She builds relationships through better understanding what people and businesses need, and then successfully helps them reach those goals. The Kansas City area native with more than a decade of experience in strategic communications currently serves as membership and marketing vice president for the Builders, a chapter of the AGC, and as lead coordinator for the National Construction Suicide Prevention Week initiative. Crawford also serves as a member of the Construction Working Mind Summit Steering Committee and works collaboratively across the construction industry to find innovative ways to get more mental wellness support to workers. Please welcome Angela.
Thank you, Izzy, and thank you to everyone joining us for this webinar today. Your participation gives me hope. It's wonderful to see so many in our industry seeking out life-saving tools and resources to take back to your organization. This is my fourth year helping coordinate the work of the Construction Suicide Prevention Week initiative, and it's amazing to see how much it's grown and how many more people are being reached each year. It's also been incredible to connect with other passionate people with a mission to help. And to that end, I want to start our conversation today by introducing one of the members of the Construction Suicide Prevention Week Planning Committee and the person responsible for bringing together this stellar group of panelists and experts. Patrick Bainbridge began at the Kansas City VA Medical Center in 2016 as a behavioral health social worker in the outpatient behavioral health clinic, providing a variety of clinical services to include biopsychosocial assessments, case management, crisis intervention, evidence-based psychotherapies. In 2018, he moved to the Suicide Prevention Program as a suicide prevention coordinator, assisting the Kansas City VA Medical Center in implementing national VA suicide prevention initiatives, educating facility staff on how to identify and engage with veterans at high risk for suicide, and engaging community partners as part of the Veterans Health Administration public health approach to suicide prevention. In June 2022, he accepted the position of Community Engagement and Partnership Coordinator with the Suicide Prevention Program, which focuses fully on the VA's public health model of community-based interventions for suicide prevention. Prior to joining the VA in 2016, he worked 9 years for Correct Care Solutions as a mental health professional, providing services in Lansing Correctional Facility and Wyandotte County Adult Detention Center. Patrick, I'll give you the stage to talk about the link between the work of the Construction Suicide Prevention Initiative and what the VA is doing in this space.
Yeah, thank you, Angela, for that introduction. So yeah, not to reiterate my background, but yes, I've been at the VA since 2016 and began in the suicide prevention program in 2018. Just this past year, 2022 began as a community engagement and partnership coordinator, and that position is what allowed me to become a member of the Construction Suicide Prevention Week and partner with them. The community engagement and partnership coordinator position is solely focused on building partnerships within the community focused on public health approach to suicide prevention. You know, my work specifically targets the veteran population, and their families, but that work allows me to partner with a lot of like-minded organizations and initiatives within the community, and which led to this collaboration with Construction Suicide Prevention Week. Late last year, I had a supervisor that went to a conference in Boston, and she saw a poster presentation by OSHA that referenced the Construction Suicide Prevention Week here in Kansas City, had sent me that information and said, this is a potential, opportunity for us to partner, and an opportunity to engage with veterans and the military veteran families in where they work, live, and thrive. And so I had reached out to Angela after that time, had some conversations on how we could partner with this initiative, and here we are today. As you all heard in the intro, the construction industry has a very high suicide rate. It's a very at-risk population statistically, and that pairs and overlaps quite a bit with the veteran community. One of our panelists will go over the data as it relates to the veteran community, so I'm not going to steal that thunder. But these are two very high-risk populations that overlap. When I started to dig in a little bit to just how they overlap, I came across just a couple of data points, statistics that I wanted to share that I think are relevant to the viewers of this webinar today. And one is just that over the last 2 years, the veteran population within the construction industry has steadily grown. You do have a notable population of veterans within this industry. And so I think it's important for those within the industry to be aware that, one, as evidenced by the Construction Suicide Prevention Campaign, that you employ and work with a high-risk population, but you also have a subgroup within that population that also is very high risk. So just know that over the last 2 years, that population within your industry has continued to grow. I came across a Stars and Stripes article. Stars and Stripes is a military and veteran publication that was talking about how veterans are thriving in the construction industry, and noted that there were upwards of over 600,000 veterans employed within the construction industry, and upwards of 11% of construction companies have veteran ownership. So I say all that just to highlight the connection, to highlight the opportunity for partnership, collaboration, and supporting a subgroup within your industry, within the construction industry, that we all can have an impact in addressing suicide risk, and working towards suicide prevention in that industry and within that population. So that's really was behind the motivation to create this webinar and partner with Construction Suicide Prevention. And just me personally, I've been a social worker for many years now, but I come from a long family history of heavy laborers, operators, and carpenters. So very well aware of the risk factors and just the things that exist within that industry and within that life that lead to increased risk. So very happy to make this partnership and present this information today. I think all of you will find it to be incredibly helpful and an opportunity to support your employees and veterans within the industry as a whole. So.
Great. Thank you so much, Patrick, for providing that bridge, that connection, and also for putting us in touch with our 3 expert panelists today. The information that they have to share, I think, is incredibly valuable, so I'm ready to get to it. Again, I just want to remind you that we should have the chat open as well as the Q&A, and we hope to make this interactive. So if you do have questions, please feel free to drop those in the chat or the Q&A as we go, and we'll make sure that we're answering questions along the way. But as I go around and introduce each panelist, I want to get started with having them provide their why. I think that this is very much a space where people there's always a reason, right? There's something that's motivating and driving people towards this mission. So I'm going to ask each panelist to share their why and what brought them to this work. Let's start with Dr. Charlotte Mccloskey. Dr. Mccloskey is the local recovery coordinator and a staff psychologist at the Kansas City VA Medical Center. She serves on a detail for the Office of Mental Health and Suicide Prevention, Rocky Mountain MIRREC, on focused efforts in suicide prevention for Native American veterans. She received her master's and doctorate from the University of Missouri-Columbia with an emphasis on teaching and multicultural psychology. Outside of her work at the Kansas City VA Medical Center, Dr. Mccloskey has held faculty positions, private practice, and worked in a grant-driven preventive health research. Her professional and clinical interests are focused on mentorship, consultation, recovery, resiliency, trauma, grief, and loss. Dr. Mccloskey, you want to share your why with us?
Well, good morning and good afternoon. I'm not sure where everybody's coming from, but thank you so much for having us, and feel very honored to be able to speak with you all today. So my why is actually part of my profession or my position right now with the VA. So I'm the local recovery coordinator, and I have a deep passion for mental health and mental health recovery. My why is because I believe that everyone deserves access to good mental health care, and then also that recovery is possible in mental health care. The why I work in the VA is that I'm the daughter, the granddaughter, the niece, the cousin of many veterans, and so it's by giving back. But I'm just very excited to be with you all here today. But again, my why is because I'm hoping that we'll share some information that will put some hope in some of the participants to pass along to the people that they work with.
Thank you. We'll go next to Dr. Zachary K. Parrett. He is the Suicide Prevention Program Manager for the Department of Veterans Affairs, VHA, Heartland Network, which covers a majority of the Kansas, Missouri, and Southern Illinois region. His duties include the programmatic oversight of VHA's critical priority mission to prevent veteran suicide, both within VA medical centers and communities where veterans live. Zach is a clinical psychologist trained in neuropsychology and physical rehabilitation psychology from the state of Indiana. He is also a board member for a veteran peer support service organization and a clinical associate professor for the Kansas University School of Medicine. Parrett?
Good morning, everyone. Thanks for having me. I'll keep it brief, but to be honest, I think my why is being built every single day. I actually never, as I was going through my graduate training, never imagined working at the VA. But since my time started, the ability to work with folk that show incredible resilience, incredible grit, and that have folks in their bubble, family, friends, caregivers, that continue to put forth work every single day to help care for one another. That's an admirable population that I'm happy to be part of. And as you all come into play, for you all to be the supports for those types of individuals, I'm really happy to be here and talk with you today. Thank you.
Thank you. And last but not least, John Sabala is the Veteran Services Director with the Missouri Department of Mental Health. He is responsible for the statewide policy and program development, implementation, and operation of supportive services for service members, veterans, and their families. John is a certified peer specialist and a retired U.S. Army infantryman with 22 years of service, whose deployments include Operation Desert Storm, Kosovo, Operation Iraqi Freedom, and Operation New Dawn. He is also the co-lead for the Missouri Governor's Challenge to prevent suicide among service members, veterans, and their families. John?
Hello and good morning, everybody, and thank you for having me here today. Excited to be part of this. And I would tell you my why is working in this space, having this lived experience with mental health and some substance use. I couldn't help but touch on suicide prevention work, because everywhere I went to address mental health and substance use, suicide kept coming back into the rotation. So this is a great opportunity to help save lives, and that's really what drives me.
Thank you, and thank you all for being here. To help set the stage for our discussion, Dr. Parrett, will you please share some background with us about the impact of suicide on the veteran community and what factors contribute to a higher risk for the veteran population?
Absolutely, and thank you for the invitation. I will share my screen. Please interrupt me if you cannot see it here in just a little bit. Okay. 3-second count, hearing nothing, hoping that you all can see this. I won't take too long to lead you through a death by PowerPoint, but I did want to help set the framework for our discussion today, and I really want it to be a discussion and to give the expert thoughts from the other panelists. But just to give you a bit of a background for kind of where we're centrally located. Again, my name is Zach Parrett. I'm a clinical psychologist. I am the lead suicide prevention coordinator for VISN 15. We call it a VISN as kind of a network. So this network of the Department of Veterans Affairs is comprised of 7 different facilities. These facilities, as you see on the map, represent the heartland of America. I think where many of you are stationed. But our 7 facilities work to provide healthcare and really beyond healthcare to all the veterans that live within these catchment areas. So we cover a significant portion of both Kansas, nearly all of Missouri, a good bit of Illinois, southern Illinois, as well as southwestern Indiana and northwestern Kentucky. So we have many different areas of catchment, many different types of our population that we serve, and to suffice to say, it's broad. So coming from that perspective and from that standpoint, that's really where I wanted to hone in our conversation. Keeping it sort of local, but knowing that whatever we're talking about here within this area is very much representative of nationwide too. So here's the overarching challenge that I want to present to you, or to frame your all's thoughts as we're discussing today. Quite frankly, what are your organization's biggest questions around suicide, and as well, maybe most importantly, talking to people who appear to be in crisis, who are in crisis. By all means, we don't just work on our happy days. We don't just work on the days where life is going well. We work to provide, we work to support, we work to be a part of something. And life is destined to throw things every which way, but we still go to work. So folks are in our midst. Just to briefly discuss kind of where we are in a state of affairs, what we do know is that suicidality, suicidal behavior, as kind of all the terms that we'll talk about, we know that this is a national issue, not just within the construction industry, not just within the veteran population, but it's a national issue. And there are particular subgroups of our society, of our population, that have higher risk factors or higher rates. And there's reasons for that, which we won't necessarily get into with my discussion today, but just know this is a national concern, by all means. Really important factoid that I want you all to walk away with, and just kind of to appreciate what this means from a research standpoint, but I think personally, many of you can also come to grips with this, is that for every death by suicide, we know that there's approximately 135 other individuals who are impacted. 135 individuals that are part of the ripple effect for every single suicide completion. That's a lot. That's a lot of impact. And you know, your all's organizations certainly are a part of that ripple pattern. But just to know that this is incredibly impactful from a societal standpoint. Briefly to run you through this data slide, and again, not to go too far in the weeds, but what this represents for you is, on the orange line, the non-veteran U.S. adults, we have a significant problem with suicide rates. Okay, the blue line on top of that is the veteran rate. So suffice to say, to put it short and sweet, veterans have a significantly higher rate of suicide completions than the non-veteran U.S. adults, which already is significant. It's already problematic. Every year, the VA collects data and publishes an annual report. That data is massive. So it actually takes a couple of years in catching up before we can publish. So we work with data that's a couple of years old. The last data source from this graph was 2020, but from all the years prior to that. What we do know is that in 2020, veteran suicides made up nearly 14% of all adult suicide deaths, which is much more significant than the makeup of only about a 7.5% veteran status in the adult population. So veteran suicide rates take up a much higher proportion, a much bigger piece of the pie than just the veteran population. Why? Why suicide? There's no one answer. There's no single cause. What we do know is that it's complex. There are a lot of factors that go into somebody's risk, from an individual level, from community connection levels, from societal levels, all kinds of different factors. So there's not just one, no pun intended, no just one smoking gun that we can identify and we can help to control and help to treat. As we talk through this slide and as we talk through going forward, I want you to think of, it's not just some people are suicidal and everyone else is not, right? What I do want you to think is that everybody, myself, everybody that I'm talking to included, has a profile of risk, a profile of risk factors, of protective factors, of things that are constantly moving up and down in life that impacts those risk factors as we move forward. And when we talk about that, then we can help to normalize or to understand each other's just ways of getting through the world, okay? When we talk about profile of risk, we talk about two kind of separate areas. A risk factor area that puts somebody closer to the edge, and a protective factor area that helps to reduce some of those risk factors. Our job as mental health professionals, as those that are helping to guide and get folks connected with treatment, are to emphasize the protective factors while helping to offset or reduce the risk factors. So what does somebody's profile of a risk look like? This is not an exhaustive list, but I do want to talk of some of the priority areas, especially with risk. What puts somebody closer to the edge of suicidal risk? If they've had a prior suicide attempt, that's one of the biggest factors that we'll talk about, that we'll ask about, that we'll look for. If somebody has utilized that tool in the past. If they have significant mental health issues at play, substance abuse, substance misuse. Absolutely, if they have direct and quick access to lethal means. If they've experienced loss, especially recently, if they're having challenges with the legal system or finances, if they're having relationship issues, if they're having difficulty with gainful employment, or if they're having concerns with secure housing. Okay? Certainly absolutely risk factors. Protective factors, on the other hand, and this again is our job to help to emphasize these. Do folks have good access to care, good health care, good mental health care? Do they have a feeling or a sense of connectedness? Do they have a skill set of problem solving, mission or purpose in life, good physical health for where their expectations lie, gainful employment, and are they doing well in their social worlds and in their emotional worlds? Thinking about this, and especially as related to you all, I want you to think about that we all have a toolbox that we carry along with us no matter where we go to get through life, to get through our days, right? Thinking maybe even back to that first prior suicide attempt part, I want you to think about folks' toolboxes that might have suicide as one of those tools. And oftentimes we find that when folks reach for that tool of suicide, they've been trying to use every other tool that's available, right? Every other tool that helps to either get them through or get them past or just just to bury whatever's going on, or to actually problem solve through an issue. But folks that find themselves at the doorstep of suicidal behavior often find that they don't have any tools left for the job and resort to that one potentially final use of a tool that is suicide. Just to briefly talk about kind of some local data, but also pushing out nationally, wanted to bring up with you what we know as from a lethal means behavior standpoint. What this chart is showing you is that not only in Missouri, but in the U.S. At large, firearms are the most common but also the most lethal form of suicide attempt. Okay, in the veteran population here in Missouri, where I'm actually sitting right now in Kansas City, over 75% of suicide completions were utilizing a firearm, compared to a pretty similar number across the U.S. We'll talk in the next slide here and wrapping up here shortly, but we'll talk about kind of the lethal means and the ability for those things to unfortunately be enacted. What we do know, and I share this with groups that I talk to, I share this with veteran groups when they're in treatment. What we do know, one of the most consistent parts of service member training, what are all veterans what have they been trained in during their duty status? They've been trained in the use of firearms, not only in the use of them, but for the advocacy of them, the proficient use of them, and also the thought of a firearm as an extension of one's own body for protection, for completion of the mission at hand. So it's consistent with what we know that, of course, veterans as a population are likely to have better access or own more firearms after their duty service ends. Okay, which unfortunately creates a bit more of a complex situation. Grand takeaway from this slide, as I start to wrap up, is that what we know is that suicidal crisis is often very time limited, to the point that even over 70% of folks who decide to utilize the tool of suicide do so, when they do so, within an hour, within 60 minutes of time. Okay, nearly 50% of them act within 20 minutes, and nearly a quarter of those individuals who have died by suicide did so within 5-minute time frame. Okay, moving to the right, this is the absolute reason why we stress lethal means restriction. Okay, we know, of course, that firearms are the most lethal form of suicidality, to the point of 85 to 90% of them of those attempts are fatal. Compared to all other methods combined, only 5% of different tools are successfully fatal. Okay, so VA nationally, community nationally, we are stressing absolutely restriction to easy access to firearms. So we're talking about firearms and appropriate and consistent safety of storage, with all different types of ideas, and constantly moving forward with what we can do. Big takeaway: find somebody also in crisis. Don't be afraid to ask them what's at hand. Is something concerning you? Does something feel unsafe around you right now? And how can we help to help keep some of that safety on board? Lastly, we're great at acronyms in the VA, but I want you to walk away with this one in particular: SAVE, S-A-V-E. And we'll talk about this, I think, and outline this as we move forward with other panelists. But as it stands, S stands for the signs of suicidal thinking should be recognized. A, we ask the most important question of all, which might be something as direct as, hey, are you thinking about hurting yourself? Are you thinking about suicide? V, we validate the veteran's experience, that person's experience. And E, we encourage treatment. We expedite getting help.
Thank you. I appreciate you helping set the stage for our conversation, Dr. Parrett, and want to make sure that we have time to hear from the full panel. So I think, knowing what the risk factors are, why the veteran population, which has a lot of similarities to the construction population, not the least of which is an overlap in who those people are, of course. So we understand what those are now. What can employers do to help mitigate the risks within this population? What are resources that they can help provide? And I'll let either Dr. Mccloskey or John jump in to answer first, since we've heard from Dr. Parrett, but of course, any of you are welcome to chime in.
There you go. So this is John. Let me go ahead and start this off. So some things that employers can do, right away, and he did touch on it already, but suicide prevention training for leadership It's hard to prevent suicide if you can't recognize the early warning signs and clues, or understand what can place people at increased risk, or what can help protect people against suicidal thoughts, ideation, and attempts. So I think it's important for leadership to take some time, learn how to recognize the early stages of crisis. What we do offer here in the state of Missouri is the Missouri Veteran Suicide Prevention Team can provide no cost in-person question, persuade, refer, gatekeeper training, which is a evidence-based suicide prevention course. Takes about an hour, but I would ask that you consider reaching out to the Missouri Veteran Suicide Prevention Team and learn how to identify someone at risk. And I'm going to share that resource with you here in the chat. It'll be in the follow-up as well. But that's one way that they can help. Sorry, make sure to post that. Can help mitigate people at risk of suicide. I would also ask that you think about the insurance. I know it sounds a little bit odd, right? How can insurance help prevent someone from being at risk of suicide? But insurance can be a barrier for some of the healthcare issues that increase someone's risk of being suicidal. An example, we have the state of Missouri, all Missouri employees have access to a TRICARE supplemental insurance program for those that are military connected and have TRICARE insurance already. And what that does is first the TRICARE insurance kicks in, and then the supplemental can help cover some of the additional costs, the co-pays, as it were, which is great for someone like me that's a veteran that has TRICARE. If your insurance plans that you offer, or health insurance plans that you offer, do not have a TRICARE supplemental, I would ask that you peek and explore at that a little bit, because it's a lot less expensive for me to purchase that through my state of Missouri insurance than it is for a larger package, more expensive package. So that's something to consider. Charlotte?
Yeah, all of those things. But then also, it's really about just getting some education. So both about military populations, veterans, but then especially if maybe you're not familiar with it, especially your leadership team. Because again, some of those signs and symptoms, as well as some of the protective factors, you might not be as aware of. So that would be the first one. The second part I would also say with this is also get to know your veteran service organizations, as well as, because the thing is that of course we would love to see every veteran walk in the door at the VA, but we know that that might not be their choice. So we want to make sure that, again, in your areas, get to know, who is also providing great mental health care, again, within, your public health spaces, or within the veteran service organizations. And kind of the primary thing is just make sure that they're really familiar with veterans, because that it can be a huge barrier to care. I'm going to pop something in the chat, which is called Make the Connection. And this is a website that's got over 1,000 different videos of veterans talking to veterans, as well as the public, about mental health care, treatment, and again, kind of coming back to this hope. There's also family members and a whole bunch of other stuff on here. So I just want to encourage folks to pass this along or watch a few of these.
Thank you. And Dr. Parrett, do you have anything you wanted to add about this question as well?
Sure, if I can find the mute button. What we know about anybody's suicidal risk is that it boils down to connection. When folks start to feel disconnected from their world, from their communities, from their support systems, and start to feel isolated, not to mention that any of the problems that they might be having feel like it's just too heavy to bear, or too heavy for anybody else to bear, that's when things start to really pick up steam. So in organizations, in a staff employer's ability to do whatever they can to help provide mission forward support, and helping to allow folks to feel connected and feel part of a community can go a tremendously long ways.
I want to come back to the mention of insurance, John. In construction, employee assistance programs, employee resource groups, those are very popular, very common. So can you speak a little bit to what employers can be looking for as they're evaluating those things as part of their benefits and what they're providing to their workforce? And anyone else, of course, can jump in on this as well.
Wow, great question. All I know about think about it this way, just because they've served, they may not be accessing VA services or TRICARE. So that's important to understand, that if you have somebody during the employment process that you screen and do identify that they are a veteran or have served in the military, or maybe currently serving, like we think about the National Guard. National Guard service members are still fully employed, but may just do weekend drill. It's important to understand what insurance they have because of their military service. I would tell you that the TRICARE Reserve Select, I think that's the old school name for it. I think it's changing names. They may not, the National Guard service members may not actually opt to pay for that, because that does consume a bulk of that weekend drill pay. And at least in the state of Missouri, some use that weekend drill pay as their primary source of income. And then next up, they start working in construction as their other job. So I would ask that you screen and make sure you understand what insurances they may get from their military service. And that's about as far as I could dig into that. But just know that not everyone has TRICARE or access to TRICARE or access in VA.
So there's actually a great comment in the chat, and I just want to give a huge shout out in here because this is a great way. So the QPR training, as well as mental health first aid, this is usually offered through public health services. And again, this is a great way of just kind of learning more, and then also just kind of empowering your staff to be able to just kind of be that support for one another. This is something that we are doing a lot of kind of being more mindful of, even within the VA itself, of just how powerful this can be and how much we need to be doing this. The only other thing I would just wanted to add for as far as the EAP, I just wanted to give a huge shout out for that because that's really awesome. Is also just to really make sure that your EAP programs actually have folks that actually are familiar with military or veteran populations. Again, if we want to have these services available, and if they don't, then maybe thinking about ways in which you can connect with other services that might be, and whether it's the VA or as John was talking about, somebody might not have access to some of those healthcare systems, but again, just really making sure you have that. I wanted to share one resource that is going to be available to everyone, which is some mental health apps that actually the VA has. I'll talk a little bit more about it later, but I thought I'd throw it in here for now because there actually are quite a few things in there that you can just pass along. But I'll stop talking here.
Dr. Parrett, did you want to add anything on EAPs or ERGs?
No, beyond the idea, maybe going back to the comment about how effective they are. They really are. In EAPs look different. The reasons for why calling 988 look different, but there really are tremendous amounts of success that are found when folks are able to say and able to take the step to say, yeah, I need some help. So get me connected. And I like to think of the process as, even if you yourself are not a mental health professional or feel like you're completely trained to handle the full task or crisis at hand, if you can do whatever you can, even if it's just as being a friend or being a confidant, if you can help take somebody a couple steps down the road, hand that person off to somebody else who can take a few more steps, we can really start to get folks much further down the road, further from the edge from what a crisis might be leading them to.
Angela, if I could share some more examples of what employee assistance programs and employee resource groups can offer. Understand that I am not in the construction industry. I'm just sharing you examples of other places, other industries that have done some work in this area. One of the examples I could share with you as far as creating a peer network of some form. The Missouri Department of Transportation, they actually host quarterly lunch sessions of information, professional development classes and things like that, covering a wide array of topics. not just focused on mental health or physical health or suicide prevention. But this is a great example of creating a peer network to share information. Now, I understand for the employees, this might not be something they can have easy access to, but this could be a great resource for those working in this space to come together and share professional development, have speakers show up and maybe record these sessions and make them available to employees if they want access to them at a later time. So creating a peer network, this could be something for maybe just veterans, or you can make it for the safety officers or whatever you feel is necessary. But that's just one way that the EAPs and ERCs can help out. Another is identifying veterans. In the higher ed institution, there are several across the state of Missouri that actually have these little labels on doors or signs on doors or cubicles that say, "I served." And what this does is as student veterans come by and see a professor's door that might have this "I served" placard of some kind, it lets them reach out and lets them connect. So is there a way that we can incorporate this in the construction industry? Some kind of sticker, badge, logo, something to identify them so that they can help start building this peer-to-peer relationship and this peer-to-peer network that Zach mentioned earlier about not feeling alone or isolated. So this could be something to explore. I think promoting awareness and education, we're going to say this with every section, and I think every panel member is going to say this, but one of the ways we do this in the state of Missouri is we have our Missouri Buddy Check 22 Day, and it's been designated the 22nd of every month that we take time to help raise awareness, promote education, and encourage people to reach out and check in with a fellow service member, veteran, or family member in the state of Missouri. We do this as part of our suicide prevention work in the state. And let me drop in the chat, we do have a website for that you're welcome to explore on your own. But again, just designating this 22nd of every month and encouraging people to reach out and connect with others is just a great way that I think the EAPs can help promote this as well. I don't want to consume everyone's time here, but I have just a couple more examples that you can share. Missouri Governor's Challenge, we did mention this during the bio. Missouri Governor's Challenge, a collection of state and community and federal agencies all working together to prevent suicide from military community. And one of the things we have on the website is a challenge. We challenge everybody to do 3 steps, and one is to learn about how to prevent suicide, and that's the classes that we keep talking about, whether it be SAVE, whether it be the QPR training that the in-person trainers can do. But we also have the SAVE that's available online. It's done with Psych Armor in partnership with the VA, so you're welcome to access that training. And we also encourage people to watch a short video about safety plans. It's a great video, lets people know how they can engage with people that may have one. There you go. And then the last thing we do is tell them to stay connected with us to learn more about this issue. And the last thing I would do is just make sure that you have a wide array of resources for the veteran community to meet those needs that can place people at increased risk of suicide. I understand you work a lot with pain management. You might have access to those kind of resources as well. But what about supplemental income? What about housing assistance? What about emergency utility bill assistance? Those things that can place people at increased risk of suicide. If you don't have access to community resources like that, we do have something here in the state of Missouri through the Missouri Veteran Commissions. They have the benefits and resource portal. I can share that too in the chat in just a second, but it's just a collection of resources, military connected, to help meet some of those needs. So sorry, I'll turn off the mic here and turn it over to others.
No, that's all right. Thank you for all of that information. We are starting to get a couple of questions and comments in the chat, so I want to make sure that we turn some attention to those. And one of them speaks to something we've alluded to a couple of times, and I want to make sure we dive in more detail, and that's the 988 number. Can you talk a little bit about how veterans can access a veteran dedicated support line similar to what the 988 number is? And I'm asking this, and I know the answer, but I would like to hear from you what maybe employers who have veterans in their population should be telling their veteran employees to do if they're in crisis. And then also, if you have any information, it's a relatively new number, right? They just rolled or redid the number. And so do we have any information about the usage or the impact that this has had?
So when we were chatting about the panel members were chatting about this, I did want to just talk briefly about 988 itself before they dive into the crisis line. And so people understand the differences between that. And I also want to make sure to include this because we have to keep in mind the family members as well, not just those veterans. So 988 itself could be a great resource. In Missouri, our 988 system is a crisis system, has 3 different ways that we do this. One, we offer someone to talk to, and that's the 988 crisis line workers. They accept calls, texts, and chats. They help with immediate needs and connect people with resources for ongoing help. The second way is someone to respond. Someone to respond. If they are in crisis and the crisis line is not enough, we do have mobile crisis teams in the state of Missouri, which has clinical and peer people that can go out into the community and provide in-person help. And the third way our crisis system is working is somewhere to go. If a person needs more help than what a mobile crisis team can offer, then they can go to our behavioral health crisis centers. The crisis centers offer intense help 23 hours straight, and they help de-escalate a person. And this is for mental health, substance use, and for suicidal crisis. So I would encourage people to visit the Missouri988.org website. We offer toolkits as well to where they can go and get merchandise to help promote 988, to include Veterans Press One. We have that on the website. So let me switch over to my VCL partners.
Sure, I can join in. So I think suffice to say the easiest way to understand is that the VCL, the Veterans Crisis Line, is an extension of 988. So if a veteran, and to John's point, not just a veteran, but anybody caring for a veteran, I've got some really cool stories about somebody taking an initiative for a veteran on their behalf. But if somebody wants to get a veteran help, and they call 988, the first thing that they would do to connect to the Veterans Crisis Line is to press 1 at that prompt. And what that does is that actually gets you connected to a VA entity, the Veterans Crisis Line, with 24/7, every single day, trained responders on the other end to help be there for an individual for whatever is going on. And to be honest, whatever somebody feels like is a crisis. We all have different thresholds about what makes a crisis in our lives, no doubt about it. And so that individual would help the caller with whatever the concerns are, can do a number of different tasks, but the biggest one actually being that by the end of the phone call, if the veteran is up for it and agrees to it, they can connect and within a day get a response from their local VA hospital, from suicide prevention coordinators like myself that are staffed within each hospital to reach out to that individual, follow up, if we need to get them connected with care, whatever it might be, kind of a one-on-one level. So as long as somebody opens the door for us to get somebody some conversation and some help, we can really take folks a good ways down the road.
If I could throw one last thing in there, I know we're running really short on time. The other part about 988, because I end up working with a lot of veterans and they're always concerned about who they might be talking with. Just to let folks know, I know that the VCL is staffed heavily with veterans, but we also do something which is an outreach. So if a veteran calls into the Veterans Crisis Line and emergency services are dispatched, they're going to get a follow-up phone call. And we're going to continue to keep following up with them, not only from the VA side, but also from a whole team of veteran peer support specialists that work directly for the Veterans Crisis Line. So for the VCL. So just to let you know that it's a loop that continues. And again, we just want to support veterans, especially when they do call in. And the same thing also for families, and families can call in as well. I threw a few more things in the chat, but I don't know what we have time to get to. So I'll pause there, but I have one more thing to throw in there. So.
Okay, perfect. Yes, and just want to make sure that we are respecting everyone's time. So I think this other question we got in the chat from Jamie is an excellent question, and I want to address that and then maybe start turning towards our wrap up. So Jamie asked, how do we balance a veterans' advocacy for gun rights with the need to restrict access for their own safety or for their family members, and perhaps some recommended messaging? Of course, there's we're in the Midwest, there's strong culture, hunting and other recreational use. And so there is definitely a balance there that I think we do need to be mindful of as we're putting information out there about safety. So if you have any recommended messaging or, any thoughts about how we can strike that right balance, I think that's a great question.
John, love to hear your thoughts about gun right advocacy.
My sincere apologies, my friend. I was trying to reply to someone in the chat room. My sincere apologies. It was an important question from Jeff, and I apologize. Jeff, the 988 is for everybody, not construction workers only. The Veteran Crisis Line is for veterans and their families, for more VA-specific resources and connection. Sorry, I didn't want to miss that. It was an important question.
Absolutely. And John and Angela, if you don't mind, I'll take it away. We approach this conversation all the time, talking to veterans about their rights and gun advocacy and to bear arms, but also lethal means restriction. How do we go about that conversation?
Yeah, so great. There's some courses out there available that can help people talk about that well. And it is definitely a challenging topic to have. The veteran community, firearms are very near and dear to them. It's really an extension of ourselves at times, depending on the jobs that you have in the military. So it is a difficult discussion. We talk about gun storage. When I talk about this with people, this may sound a little odd, but I think about it as if you're out at a bar and you notice your friends had a couple too many drinks, then we take the car keys from them and we give it back to them when they're feeling better the next day. And when I have this discussion with veterans, I talk about firearms in the same way. Notice you're not feeling well. Let me take this from you. When you're feeling better, you can have them back. And that's how I have that discussion.
I also just wanted to share a resource too. So the VA has all of these research hubs. And so again, some really great resources. Now, granted, some of those are kind of written for clinicians, but there are things that actually anyone can access. So I dropped it in the chat. It is one of our MyRecs that is focused on suicide prevention. So hopefully there might be some resources there. It might be helpful.
Thank you so much. And as we start turning towards wrap up, I have one final question. I'll ask each panelist to spend just a minute telling us their one thing that people who are watching this webinar can as soon as they wrap up, can step away and immediately start putting into action. Because I think that's the biggest part within construction is we just want to know what can we do? How can we start making a difference now? And then if there are any additional questions, please do feel free to reach out to us and we're happy to pass those along as well. So what is your one takeaway, your one action? And we'll just go around the group here. So Dr. Mccloskey, do you want to start?
Yeah, and I'll make it quick. I just want you to make friends. I mean, that's literally what I want you to do. Learn from the VA, right? The VA at one point in time, we just kept trying to do everything on our own, but we have learned that it's really important that it takes everyone to do this. So September is Suicide Awareness Month and Suicide Prevention Month. And so there are so many walks, so many mental health summits going on. So just go to one of them. That could be your action. Find out some other people who are trying to do the same great work and start thinking what you can do together. And maybe you can even just start here. So that's my one. Make a friend.
Thank you. Dr. Parrett?
I might extend from that, from what Charlotte had mentioned, not only just make a friend, but be a friend. It's an interesting world out there, right? And we all know that there are a lot of tough situations that a lot of folk are venturing into. And to have compassion and somebody to care about you we've all felt it, right? Every single one of us have felt how powerful that can be. And so if you can be that person, especially and you might not even know about it, but in maybe potentially the worst time in somebody's life, just to be a friend or to be somebody that recognizes, you all know your staff better than anybody else, right? You see them every single day. You know their behaviors, know their personality. We teach this to everybody that works at the VA too. You'll get to know people that are walking through the door. And if you notice a difference within them, check in, right? Be that friend, be that person that says, hey, I get it. What's going on? I might not have walked in your shoes, but I know that's your shoes to be walked in. So what can we do together? So not only make a friend, but be a friend.
Yeah, and this goes in line with what everyone else is saying already, but be engaged in the Missouri Buddy Check 22 day. Be engaged in it because it does the things that the other panel members have just talked about too. And encourage everyone to check in with someone on the 22nd each month and get participation in it. It promotes awareness, raise awareness, promotes education and training. So just be engaged in Missouri's Buddy Check 22 day and really reach out and connect with someone. Make sure we're doing okay.
Thank you. And thank you, all of you, for your time today and for sharing all of your expertise and resources on this topic with us. I know that we could spend hours on this with the amount of work that you all do in this space. So I appreciate you taking the opportunity to help us in construction learn from what you're doing at the VA. And thank you to everybody who attended to listen to this conversation, to find your takeaways that you can go back to your organization and implement. And I hope you will participate next week in Construction Suicide Prevention Week. With that, I'll turn it back over to Izzy to close us out.
Thank you, Angela and panelists. Thank you to everyone who joined us today. We will send a recording of today's presentation to all registered attendees, and we encourage you to share with your colleagues. We will kick off Construction Suicide Prevention Week next week on Monday, September 4th. So make sure you visit www.constructionsuicideprevention.com to register your participation. Have a great day.